Good afternoon. My name is Catherine Crawford. Myself, along with Jody Norris, Sharon Hicks, and Chelsea Morton will be presenting rheumatoid arthritis. Our objectives are for the listener to be able to list the risk factors for developing RA with 90% accuracy, list the body symptoms affected by RA with 90% accuracy, identify ways RA affects daily living with 85% accuracy, identify how RA is diagnosed with 85% accuracy, identify ethical issues related to RA with 85% accuracy, and to be able to list with 90% accuracy the common signs and symptoms of RA. RA is defined as a chronic and progressive disease causing inflammation of the joints, which can result in painful deformity and immobility, particularly in your fingers, wrists, ankles, and feet. And as you can see in this picture, this is a normal joint, this is a joint with osteoarthritis, and this is a joint with RA. With this joint, you have excess fluid right here, making your knee be able to move in that ball and joint socket with ease. Here, with osteoarthritis, they have that inflammation right here so that they aren't able to do this as well. And here you have inflammation here on both sides as well as right here. The history of RA is extensive. Rheumatoid arthritis is a Greek term that's defined as watery and inflamed joints. Many experts believe that RA was first described in literature and art of ancient cultures, and these ancient texts date back to Roman, Greek, and Byzantine empires. And this photo right here is it's a portrait called The Three Graces, painted by Peter Paul Rubens, and it's one of the earliest portraits depicting the hand malformation that's typically associated with RA. At closer glance, you can see where one of the three graces, her hands have that malformation, just like someone who was actually diagnosed with RA would. It was first described in 1800 by Augustin Jacob Landry Bourois of Paris. He originally was able to see patients during his residency that were coming in and complaining of severe joint pain. He assumed that there was a relationship between RA and gout, which today we know that there is none. But he originally named this condition gouty asthenique primitive or primary anesthetic gout. During the 19th century, Alfred Garrod was the first physician to distinguish gout from other arthritic conditions. He found that excess uric acid in the blood was related to gout, and in patients with RA, there was none of that excess uric acid. Recent studies estimate that 41 out of 100,000 people are diagnosed with RA per year. The incidence of RA rises with age, and it's typically, you see typical onset about 65 to 74 years of age, and that's for both men and women. In 2005, approximately 1.3 million Americans were said to have RA, and approximately 300,000 children have the juvenile form of this disease. Risk factors for RA, you have socio-demographic and modifiable. Typically, RA is seen 2 to 3 times higher in women than in men, and its onset, like I said earlier, is higher in 60s and 70s, and that's the same for both men and women. Modifiable risk factors would include, not smoking, using oral contraceptives, using hormonal replacement therapy, and they have shown recent studies saying that breastfeeding can lead to reduced risk factors of RA. And Jody Norris will be continuing our presentation.